Hi there, this is Dr. Raphael F. Cruz, MD, and today we're going to be talking about testosterone replacement therapy in men. And we're going to be covering the most frequently asked questions. How do you know if you should have your testosterone level checked? Basically, a lot of men, probably almost 50% of men over the age of 40, are experiencing low testosterone. And some are asymptomatic, so they have no symptoms, and some have very significant symptoms. Not just, less firm erections or loss of interest in sex or loss of libido, but pronounced depression, anxiety, sleeplessness, loss of muscle mass, loss of stamina, decreased ability to work out, decreased interest in work, or enjoyable activities that they previously enjoyed. And all of those symptoms combined are very harmful to a man's health. So testosterone isn't just about your libido and sex life, it's a lot about improving your vitality and zest for life, and it's one of the most important anti-aging tools. So if you have any of the above symptoms, it's a good thing to check your testosterone level, as well as some other basic labs like a complete metabolic profile, a complete blood count, your thyroid levels, lipids, hemoglobin A1C, and even viral antibodies are sometimes contributors to fatigue. And so you want to cover all your bases and not just look for low testosterone as being the root cause of all of these symptoms. The big question is how much this therapy costs. If your testosterone level is below 250, most commercial insurances and Medicare will cover the cost of testosterone. At Kentuckiana Integrative Medicine, we tend to treat men who are, say, 300 to 500, but have significant symptoms of low testosterone. And in those cases, insurance does not cover the service. And we charge a $300 consult fee and then $2,400 for the year to manage your therapy. And that involves reviewing your symptom profile and your labs 3 to 4 times a year and adjusting your medication accordingly. You can receive testosterone therapy through several different modalities. So you can apply it to your skin as a cream. You can have sublingual or under the tongue troches or tablets, or injections once a week, twice a week, or even once a month. And you can also do under the skin testosterone pellets. And each of those approaches have advantages and disadvantages. Primarily, the daily medication under the tongue or tablet that you take, or cream, has to be applied daily. The cream can be a little bit messy and can get on other people. And some of us have trouble with remembering to take medicines every day. And the low testosterone with its associated depression can cause poor memory, poor concentration. So some men prefer, in fact I think most men prefer, a weekly injection and or testosterone pellets. And testosterone pellets will last 3 to 4 months, sometimes longer, but that is the most convenient and also the most expensive approach. Some clinics will have you come in once a week for your injection. We can offer you that. We prefer to teach you how to self-inject. It's quite easy, and in the busyness of life, most men prefer to learn how to self-inject and then to follow up every 3 to 4 months. If you do need weekly injections, then you're going to need to be a local patient. If you want to be treated through telemedicine, then you have to be in one of the states that I'm licensed in and have a DEA, which is Indiana, Kentucky, Florida, And testosterone replacement needs to be done judiciously. There are some clinics that give men a lot of testosterone too quickly, and then men feel just as bad as they did when they had low testosterone. So you can have a testosterone above the normal limit, say 1400, and feel as if you have very low testosterone. And that happens when your receptors become insensitive to the testosterone and they no longer respond. So we have strategies to help you maintain your own production of testosterone and to preserve the testosterone receptor sensitivity, and that allows you to benefit from testosterone for many, many years. But you have to implement these strategies, otherwise you can have a very high testosterone level and feel very crummy. The cost, I think I mentioned this earlier, is $300 for the consult and then $2,400 for the year. It includes the prescription for blood work and the visit with me 3 to 4 times a year. And it includes injectable testosterone. But if you want creams or oral medications, then you'll have to pay for that separately. And testosterone pellets is an additional $800 per insertion, which will take place roughly 3 times a year. Again, who should be tested for testosterone? If you're feeling the symptoms of, lack of stamina, fatigue, poor concentration, depression, anxiety, sleeplessness, loss of interest in intimacy, loss of libido, erections that are less firm, any of those symptoms should prompt you to get tested. How do you get started with us? Simply contact us through our website, www.regenmedky.com. That's regenmedky.com. And you can fill out a questionnaire there, or contact us by phone and make an appointment. Some common misconceptions about testosterone is that it can cause heart attacks or cancer. There's a significant amount of research arguing against that. In fact, there are a much higher proportion of men with low testosterone having heart attacks than men with an appropriate level of testosterone. And that makes sense because when your testosterone is really low, you tend to want to be less active. And if you feel depressed or anxious, there's a greater tendency to make bad food choices. And all of those things combined have a negative impact on your health and give you an increased risk of heart attack because you're less active and you're making poor food choices. So men with higher testosterone levels actually have a lower incidence of heart attack. Testosterone does not cause prostate cancer. It can increase the size of your prostate, which is why we follow your PSA closely. And even that is debated, whether or not testosterone increases the size of your prostate. But of course, if you find yourself peeing 3 to 4 times a night and your PSA is climbing, we would have to send you to a urologist to make sure that what most likely is happening is benign prostatic hypertrophy, which means a non-cancerous enlargement of your prostate rather than cancer. But occasionally it is cancer, and thankfully prostate cancer is very easily treated. So next we're going to talk about hormone replacement in women. Hormone replacement in women, just like in men, is one of the most important anti-aging tools available to us. It's helpful to the hair, the skin, the sex drive, or improving libido, keeping the vaginal area lubricated and receptive. It improves a woman's vitality, it improves a woman's sleep. And so if you're having symptoms as a lady of hot flashes, irritability, poor concentration, decreased interest in work or hobbies that you used to enjoy. Those are all, and you're not having periods, or you're having, fewer periods. Those are all symptoms that you are either perimenopausal or menopausal, and should prompt treatment. Ladies are a bit more complicated to treat. They can be treated with testosterone by itself, and some of them are very pleased with that, because it can be as simple as an injection once or twice a month. But most women end up using testosterone cream in conjunction with progesterone pills or creams, and estrogen pills or creams. And the best hormone replacement is bioidentical hormone replacement made from plants, because the chemical structure of those plants is similar to your body. When you use hormone replacement medications generally made by pharmaceutical companies, they're using horse urine, and those hormones are anywhere from 50 to 100 times more powerful, and they have a much higher incidence of causing blood clots and cancer. We do require that ladies who want hormone replacement have an annual pap smear, mammogram, and pelvic ultrasound to ensure that there are no issues. The risk with bioidentical hormones of those problems is very low, but of course family history and lifestyle choices influence your tendency towards cancer. So that's something that has to be a calculated risk that has to be accepted, but it's a very low risk. And even some females with breast cancer history have benefited from testosterone hormone replacement, as long as the breast cancer wasn't testosterone receptor positive. So, and then there are natural ways that don't involve hormone replacement to help women with menopausal symptoms. So how to get started with us is simply call the office, or go to our website and complete a medical intake form. And I do need to be licensed in the state that you live in, and I have to have a DEA license as well. And so right now that's Florida, Kentucky, and Indiana. The cost is $300 for the consultation, and the labs are separate, and then $2,400 for the year, and that involves you filling out a questionnaire 3 to 4 times a year and getting lab work so we can monitor your progress and adjust medications accordingly. In general, hormone replacement is a very effective approach to anti-aging, and most women really like it. That's the end of that.